Welcome to the weekly Roundup, Part 1. You've reached Talking with Dr. Terry, 180 Seconds to a Better You, message 517, and I'm Dr. Terry Wurzbacher. Jay had a great question about my recommendation that we change the word pain to something else. In my case, I called it Oscar. And that was for that particular pain. I might call another pain a different name. Anyway, he asked if that wasn't just training my brain to associate the word Oscar with pain and having it end up doing the same thing, a vicious cycle of sorts. That's by far one of the best questions I've been asked on this subject. It's also an important part of pain care. Patients are told not to do a pain journal, as I mentioned previously, and they should also not talk about their pain and let their friends and family know they shouldn't be asking them about it all the time. How do you feel? How's your pain? That's destructive because the more you talk about it and hear about it, the more it reinforces the pain. Words are neurological events. They're meaning laden puffs of air that our brain transforms into knowledge, opinions, emotions, or danger signals. The right words in a medical context can activate both the pain busting opioid networks, means that the pain relieving stuff we have in our brain already, and the feel good dopamine driven centers that we have as well. Words are not neutral in pain care. Language can amplify fear or invite safety. It can frame the body as broken or as capable. There was a woman with this thing called complex regional pain syndrome, which is a severe, uncommon type of nerve pain. It's not so uncommon anymore. Anyway, she had little pain in her affected foot as long as she didn't think or talk about it. Mentioning the foot, though, especially by her doctor, and her symptoms burst into life, causing a severe burning and prickling sensation, which is typical for that condition. Even listening to the doctor talk about it with her husband set it off. Using another neutral word when discussing your pain, and that should be as little as possible, of course, doesn't activate the emotional pain centers in the brain. Thanks, Jay, for bringing that up. I took a long time on that because we didn't have a lot of comments this week. But Ramona also talked about when I was talking about the volcano, she learned to see coal coming out instead of lava. And that was because when she thought of coal, she realized she had to work on it and dig into it to get, guess what? The diamonds. I think that's a great way to end today's thing, and we'll pick up tomorrow with the rest of the comments. Have a diamond day.